Hello there, it's Lisa Starr here with another episode of StarrCast Podcast. Thanks for joining us today as we have guests that talk about wellness journeys and wellness business and all aspects of wellness. And I think you're going to enjoy our guest for today. It's a very unusual situation that I came across when doing research for a story I was writing, looking for integrations of medical and wellness. And I came across this website of a place called Statera Integrated Health. And they had a really beautiful building picture and some nice comments. And I dug a little deeper and I thought, this is fascinating. They've got medicine and yoga and spa and classes and counseling all under one roof. And it's in, I will say, a little bit of an unlikely spot. Nothing against Dubuque, Iowa, but not known as a hotbed of innovation. So I had to reach out. And so joining us today is the CEO and owner of Statera Integrated, Nicole Hutchison. Thank you for joining us.
Thank you so much for having me, Lisa. I really appreciate it.
Well, like I said, I saw you, we chatted, and I thought this is a story that needs to be shared because we're always looking for new models, and wellness has been so much in demand lately. And here you were just going along about your business, doing something lots of people can only dream of at this moment. So I thought we need to share this story. Nicole, could you start by telling the audience a little bit about your personal work history, how you came to be ready to open a place like Statera?
Sure. Yeah. That's a great question. I actually started out as a physical therapist and worked as a physical therapist for about 10 years. Loved what I did, but realized I wasn't really enjoying going to work anymore because so much of my day was filled with paperwork rather than being with my clients. And so I left my physical therapy practice to start my own business out of my home, seeing patients, doing a combination of physical therapy and personal training and health coaching, and really fell in love with the opportunity to be able to work with people from a more integrative kind of philosophy, really talking with them about mind, body, spirit, health, and wellness, how they're all interrelated. And then after a few years of doing that, realized I wanted to connect with other like-minded providers who felt the same way I did. Knowing that none of us can be all things to all people all the time, but collaborating together, we can be so much more. We can offer so much more to our clients and patients. And in that process, thought I would rent a few thousand square feet to get started. God had a much bigger plan in mind. And so in 2018, I actually opened 11,000 square feet of brand new construction. And now today, almost 4 years later, exactly, we have 29 providers of all different disciplines. So
that's unbelievable.
A lot of learning on the job.
So you worked on your own in PT, very busy. All PT people are always busy. What was missing for you? What made you seek out the addition of other personnel?
Yeah, what was missing for me was, like I said, we can't be all things to all people all the time. And so as I was getting more and more credentials behind my name, right, I got the certified strength and conditioning specialist, I got the health coaching training and the integrative nutrition training, but still I didn't feel like I could be everything. I wanted to have a chiropractor that I could share practice with so that when there were patients that needed chiropractic care, they could take advantage of that. I really wanted to collaborate with a like-minded medical professional that could provide primary care to rule out those medical needs. And then it just continued to grow from there into massage therapy and just a number of things that we now have all together, which has been amazing.
When you were growing up, Nicole, were you exposed to wellness practices or, what made you know there was more to offer?
Oh, wow. When I grew up, actually, I was in Southern Missouri, grew up on a beef cattle ranch. And so it was meat and potatoes every night for dinner and, those kinds of things. My parents were always very healthy and active. And so I led an active childhood, but it was not necessarily exposure to, what we consider holistic, right? It wasn't exposure to holistic wellness therapies like acupuncture, reflexology. Really, all of that came later in my training, in my learning and being a physical therapist, exploring other options that I thought might be beneficial for my patients and clients. And then really in searching for ways, as I had my own kids, how can I teach my kids to take better care of themselves? And it just became an infatuation, I guess, of mine to want to learn more and more about how we could better take care of ourselves and the importance of that mind, body, spirit, health, and wellness.
Well, I think it's a reflection on your curiosity too. I mean, there's so much training involved in all of the medical fields. And I think sometimes you go down that training route and you know what you know, and you feel confident and you're successful, but you don't really look beyond for other alternative or complementary options. And I think it's awesome that you kept searching for what more you could offer.
Yeah, I definitely have a passion for learning and a passion for helping others. And so it's been good, just great to be able to bring the two together.
So the first iteration of Statera, did it have all the pieces, or did you slowly add as you grew?
Yeah, we actually started out, I'm trying to remember, maybe with 11 providers. And definitely over the course of the last 4 years, even through COVID, we have continued to grow and attract other providers from other disciplines to help, like you said, kind of fill in the gaps, fill in the pieces, right? So I always explain Statera as kind of being like a big puzzle. And we're constantly adding pieces into the puzzle. So we're seeing the bigger picture more and more, but I still believe there's so much more growth and learning potential for us that it's kind of exciting to really think of what the next 4 or 5 years are going to bring. So.
Well, I guess it was fortunate for you that when you needed a medical provider, you didn't have to look too far. Would you like to fill us in about that?
Yeah, everyone always knows pretty much right away that we are married. My husband, my medical director, is a family practice physician. And when they recognize Dr. Hutchison and Mrs. Hutchison are in the same building, pretty much gives it away right there. But no, my husband and I met in college. He was in med school. I was in PT school. And it truly was one of those love at first sight kind of relationships. And we were married in 1996. Lived in Wisconsin for a little while, Minnesota for a little while, and ended up in Dubuque, Iowa, like you said, is not necessarily where you think of as being the place on the forefront of, what's new for health and wellness and holistic therapies and those kinds of things. And so started out very traditional in our work with our clients. He was a family practice physician practicing traditional medicine. I was a physical therapist practicing just physical therapy. And like I said, over the course of the years that followed and working with clients and gaining experience and wanting to find other, options to help our patients, that is where our love interest really ignited for more holistic approaches. And, then, like I said, too, and having our kids and wanting to provide examples for them and learning for them of what it meant to be healthy mind, body, and spirit. We learned a lot. And so when I opened Statera in 2018, my husband was still practicing in his other practice, but joined us here one day a week just to kind of dip his toe in and see what it was going to be like, if he was going to like it or not. And after the first year, he said, you know what, I am having so much fun being able to spend more time with my patients than I used to be able to, and talk with them about so many more alternative options that I can provide for them, or find support services with our other team members that they can take advantage of. I just want to come full time. And so he ended up leaving his other practice, came on with us full time. And now we have grown and expanded so much that we've hired a nurse practitioner as well. And she, in less than a year, is almost full. And so we're actually getting ready to add a third medical provider for us.
Amazing. So tell us what the medical folks do. Like what's the medical side of Statera look like? What sort of things do people come in with?
Yeah, good question. And actually, I'll take that as a twofold question. So I'll start with your question about the primary care providers. They're both family practice trained, and they practice what we call integrative medicine, meaning that they really take into account mind, body, spirit, health, and wellness. They look more for the root underlying cause of disease and dysfunction rather than just treating symptoms. And then they do take into consideration more holistic or organic options rather than just medication. And so if somebody, for example, comes in with high blood pressure, rather than just immediately saying you have high blood pressure, here's your prescription, they'll talk about maybe why you have high blood pressure now.
Like we wish all of our doctors did, right?
Exactly. Let's talk about, how's your diet? How's your stress? All of those kinds of things. And then collaborating with the patient with what lifestyle changes they're willing to work on to try to get that blood pressure down more naturally rather than just jumping to the medication. So that's really the part that they play within our practice. They can see men, women, and children of all ages. So they're able to do all the traditional things like annual exams and school physicals and cold and cough and all of that. But then they do take that more integrative approach, spend a little more time with their patients, getting to know them, talking about other resources and options. But then they do also integrate in a little bit of functional medicine. And so maybe looking at some of those additional tests that we can use for individuals to learn more about what might be causing their symptoms. So
like what would be an example of some of the testing?
Yeah, good question. So like a food sensitivity panel. So testing to see maybe you don't have a food allergy, but you're not feeling good. So there's something going on. Let's do a food sensitivity panel to see if there are foods that you're sensitive to, see if we can alter your nutrition, your diet for a while to help heal your system and improve how you're feeling, mind, body, and spirit. And so, some of those kinds of things is what they really integrate into the practice. And then as far as what kinds of patients we typically see here at Statera, it's a little bit of everything. And so we might have somebody who just simply comes to see us for yoga classes or personal training or something like that. Maybe they just come in to see our massage therapist or our primary care provider. But most of the time, even if they do come in just for the one service, they quickly realize, wow, you have so much more available here. And people really love the opportunity to work with care providers who all communicate.
For sure.
It just makes such a difference. And so a lot of times they are then, it's appealing to them to come in and take advantage of more services.
Well, let's talk about some of those other pieces, Nicole. So you opened Statera, you had the family practice physician 1 day a week, you had yourself PT. What other pieces were there at the beginning? Did you open with a chiropractor?
Yeah, so at the very beginning, we had a massage therapist, myself, 2 mental health providers, acupuncture, and then we had a little bit of fitness and yoga. And that was about it in the beginning. And so it was a good combination to start with, for sure. But it's been fun since then to be able to bring in additional disciplines that have really complemented nicely, like the reflexology and the Ayurveda. We actually have a lactation consultant and a birth planner here as well. And people kind of look at us funny sometimes because we don't deliver babies. Maybe someday in the future, I hope that that's a part of this vision, but for right now, we don't have the space, to do that. But our lactation consultant and birth planner are available to be able to give additional support above and beyond what people typically get in the traditional hospital setting. And so for those individuals who want to consider other birthing options. Our birth planner can help them walk through that, help them explore what options are available, and then lactation consultants available before and after delivery to support from that perspective. So we really, embrace, all of our providers try to embrace the fact that we do see men, women, and children of all ages. Even though we don't deliver, we can support you, through getting pregnant, during the pregnancy, and then immediately following the pregnancy too. So
back to the inception, what of those modalities that you first offered caught on more quickly? I mean, you had massage, you had a little bit of movement class, of course, yourself as PT. What do you think brought in more inquiries and patients/clients?
I think people were really intrigued by the model that you don't have to just choose traditional medicine or holistic health. You can actually do both, and it's okay. We live, like you said, in Dubuque, Iowa, which, sometimes tends to be a little less open-minded about some of the holistic therapies and those kinds of things. But for those individuals that were intrigued by it, they came in right away to try, the acupuncture and those kinds of things. And it was nice to have the traditional therapies, the physical therapy, the chiropractic, and the massage therapy, the medical physician, so that those individuals who were not quite sure about the holistic part of it yet were able to come in and take advantage of those more traditional therapies and talk with us, ask us questions, get to know the other complementary providers, and increase their comfort level with trying them. And then since then, we've really grown in popularity. A couple of things. One is those individuals who have looked for answers everywhere and they're struggling to find answers about why they're not feeling well. And because we are so willing to kind of go into those more holistic practices, complementary practices, some of the functional medicine testing, a lot of times we're able to find answers that they weren't able to find in traditional therapies. But then most individuals are really attracted to us because of that integrative concept. They really want to work with a team of providers who communicate about their care.
Can you elaborate a little bit on the spa side, what you offer now?
Yeah, absolutely. And I know when I was talking to you before, you were so surprised to see we had a spa, and, why was that a part of what we do? And it's interesting. I always tell clients, we truly believe in mind, body, spirit, health, and wellness, and how we feel in our skin, how we feel about the way we look, how we present to the world makes a big difference in our health and wellness, right? And vice versa. And so having the spa in the building, we have 2 estheticians who provide holistic aesthetics. And so they do organic facials, those kinds of things. But then rather than just providing the services to the clients, they then also talk with the client about what are you doing for nutrition, hydration, stress management, those kinds of things, to help clients understand it's not just about what you put on your face, but it's really all about what you put in your body, how you treat your body, those kinds of things too, that will make a difference in how your skin appears, your skin health. So that's from the aesthetic standpoint. Massage, we have 3 massage therapists now. We had 1 when we started, we've grown to 3. I love being able to offer massage therapy options that are unique in our community. And so our 3 providers are each very different in their experience and expertise. They don't just do a traditional Swedish massage for relaxation. They're actually trained in techniques like NRT, NMT, Reiki, craniosacral, more specific sports therapy and deep tissue work. So they can provide massage therapy that is very complementary to the healing process that our clients are looking for, whether they are struggling with muscle pain from, anxiety or posture issues, whether they're an athlete looking for more specific body work, or maybe they're struggling with PTSD or something like that, and they're working alongside the mental health therapist to do some release work. They work very well in conjunction with our physical therapists, our chiropractors, so that our chiropractor can focus on what she does best, and then knows that she can turn that patient over to the massage therapist, communicate with them about, what we feel like would be most beneficial for the patient, and then they will be well taken care of.
Okay. And then I know that you have a piece that is mental counseling or behavioral counseling. How did that come into being?
Yeah, we had two mental health therapists right from the beginning, because I am very passionate about brain health and understanding that going to see your counselor or your psychiatrist shouldn't be any different than going to see your dentist or your hairdresser. It's a part of taking care of yourself.
Sure.
I think there is a lot of stigma, or at least here where I live, there tends to be, that if you are going to see a mental health therapist, there's something wrong
You're
with
bonkers, right?
Exactly. You're crazy, right? And I wanted to have a very strong presence in the building for mental health. And one of the things that patients really enjoy here, and the feedback that I get, when you come in the front door and you sit in the waiting room, you never know who is seeing which provider. You never know if you're here to see the mental health therapist or to get a massage or to go to a yoga class. It could be any of those things.
Well, that's a great point. It sort of takes the stigma out of being seen walking in, right?
Exactly. There's a certain element of anonymity to it. So when you see the car parked in the parking lot, you don't immediately know why they're there. And so I think that has really opened doorways for our clients to feel much more comfortable about talking about brain health and what that means and how that's related to their physical health. I think it's opened up conversations for them to be more comfortable to talk to their primary care provider about the struggles they're having. And it's been fun to see that grow. We're actually adding another mental health therapist here in a couple of months. So
you'll have a total of how many at that point?
So right now we have 2 full-time mental health therapists, and we have a part-time nurse practitioner who specializes in behavioral health. And we're bringing on a 3rd full-time mental health provider. And I would love to have more than that, but our space, we're getting very tight. Unfortunately, you would think 11,000 square feet, we'd still have room to grow, but we're getting pretty full. So
do you tend to see more, would you say, people with addictions or behavioral issues like that? Or is it sometimes just, I'm not thinking right? Or is it life coaching? Or, is it a little bit of everything?
Yeah, it's definitely a little bit of everything. As we've been here for 4 years, like I said, our community has really gotten to know what we stand for. We stand for mind, body, spirit, health, and wellness, and really addressing health and wellness in all of those different areas. And so clients come in and they're very interested in, not just doing one thing and expecting it to fix everything in their lives, right? So it's like, okay, if I go to this exercise class and exercise 3 days a week, then suddenly I'm going to look great, feel great, think great, and everything's going to be fine. It's more a matter of how do I take care of myself in all of these different areas. And so our health coaches tend to be kind of a central provider, kind of a core provider for a lot of our clients. They'll work with them at least initially to get a better grasp on kind of the big picture of their health and wellness, where they've been, where they're at, where they'd really like to be, helps them gain clarity on what their core values are, what their primary interests are, needs are, goals are, and then develop a plan to help them achieve that. And in doing that, then the health coach can help direct them to a lot of the different services we have in the building to support them as they go through that journey.
Well, Nicole, you mentioned exercise. Could you tell us a little bit about what you offer in that regard?
Yeah, so our whole upper level is primarily our one-on-one appointments, our quieter therapies. And so that's going to be MD, nurse practitioner, chiropractor, massage, mental health, those kinds of things. Our spa is upstairs. Downstairs, we have a separate entrance. You can either enter You can enter either level actually, but if you're coming in for fitness, yoga, physical therapy, any of those more movement oriented therapies, you can come in the lower level. We offer small group classes. We specialize in privates or small groups because we believe in our instructors getting to know our clients, know their unique needs and goals so that they can then modify the programming accordingly. And so rather than just showing up and being in a class of maybe 10, 15, sometimes more people, and some of the bigger studios, you're going to come in at maybe 2 to 4 people in your class. And so you're really going to get to know the instructor. They're really going to get to know you, and they're going to be able to help you modify anything that needs to be modified.
So real personal attention.
Real personal attention. And so we do have a personal trainer who works one-on-one with individuals, teaches classes. Most of our fitness classes are going to be body weight resistance, some of those kinds of cardio circuit, those kinds of things. And then we teach a lot of mat Pilates and equipment-based Pilates. And then we do a fair amount of yoga. And in doing the yoga, we try to offer some unique yoga classes compared to other places in town. So we have a bar yoga, a strength yoga, yin yoga, some of those different kinds of therapies. We also offer trauma-informed yoga. So for those individuals who may be struggling with
fascinating
anxiety, depression, PTSD or something, they can take advantage of that as well.
That's a very rare thing to find.
Yeah.
I'm guessing with your small sizes, like you have to charge a little more for your classes.
Yes. And that is something that was a little more difficult in the community in the beginning because there are so many options for fitness and yoga, right? And you can get your unlimited monthly membership and as many classes as you want to. And yes, it is a little bit more expensive to come to Statera, and we attract those individuals who are looking for that and appreciate that. And so typically we find we have clients coming in who maybe have some kind of a physical need. Maybe they have graduated from physical therapy, but they're not 100% yet. And so they want that more individualized attention during class to make sure we're keeping them safe. They may have had a bad experience at another gym or local fitness studio where they went into a class that was larger and maybe they didn't feel like they fit in. Maybe they felt a little intimidated because they weren't able to move as well or be as strong as the other people in the room. Maybe they were injured because they were doing something incorrectly and they're looking for more one-on-one.
Well, your approach sounds more curated, if you will. And I think it's certainly fair to charge more for that. So it's great. I love that you've identified the pieces. Now, can we talk a little bit about how they work together, right? I mean, you've got 2 floors, always a complication. You've got medical people, spa people, behavioral therapists, acupuncture, chiropractic. How does the whole thing work together, Nicole? I'm sure that's what listeners are wondering.
Yeah, good question. We are still learning that. It is something that continues to evolve even after 4 years. And so we stay in contact through we have community workspaces, one on the upper level, one on the lower level, where providers can go, take breaks, have small meetings, conversations, those kinds of things in between our larger meetings. We also have a HIPAA compliant texting service that we use so that it communicates in real time anytime they have a question for another provider. And then we do all team meetings once a month, care team meetings twice a month, where our direct care providers get together to talk about patient cases and learn from one another. So if there is a therapy one of us has started offering us something new in the clinic, then we do a presentation of that during one of our care team meetings so that the whole team can learn about what that therapy is, what an appropriate referral is, what to expect when their patient, has that therapy, how we can support that therapy and what we do, all of those kinds of things. And then once a month, we've started just last month having what we call a brown bag lunch. And during those meetings, we're actually bringing all of our providers, all of our team members, even our front desk, everyone together to talk about a topic. And so last month, our topic was anxiety. This month, our topic was gut health. And it was so much fun to listen to all of the providers and generate just great questions and share great knowledge and expertise from each of the different fields, and be able to clarify things for each other and better understand how we can better refer to one another and those kinds of things. And so that is something we will definitely continue to do. We found it really, really beneficial. And I'm going to be actually gathering all of the information that we talk about during these sessions and publishing them in a way that our providers, team members, front desk, everybody has access to them. So when they have a patient or client come in with one of the specific topics, they know what all the options are in the building.
Well, I love the care team meeting model, and it's really something taken out of the medical model. You know, how did the non-medical personnel react to this sort of meeting? Did they know how to participate? Were they shy?
And so it's interesting because that meeting is open to anybody who'd like to attend, but it's not required or mandatory, but more recommended for our direct care providers who do the medical care, chiropractic, physical therapy, those kinds of services. And then our other providers pop in for learning. They love to be able to listen in on the meeting so that they can learn more about the patients we currently have in the building, the services that they're receiving, how they're responding to those services, you know, those kinds of things, because they even sometimes become referrers for us. They'll have somebody come into yoga class that maybe is struggling with something, and they can make a recommendation more appropriately if they better know the providers and the services that are available in the building. And so they pop in and out as they're able to. And then even like our spa providers, even our estheticians will pop in, because skin care is such a big needs, and people are looking for other options rather than just prescriptions or regular skincare products. They're wanting to better know, what can I do from a dietary standpoint to improve my skin? What can I do with my stress management? How does that impact my skin and how my skin looks and how my skin ages? So it's even fun to have them pop in, and then for them to be able to ask dermatological questions from our medical providers back and forth. And so it's become this beautiful collaboration with all of these providers having a great deal of respect for one another in what we all do, but then also having that approachability to be able to freely ask questions whenever they have questions.
So it sounds like it's running pretty smoothly on the inside. I think a question listeners would be, tell us about the community integration. I mean, how did you explain what you were? Because you weren't something people had any familiarity with when you opened.
Yeah, definitely. It's been a learning curve for our community, and we knew it would be. And so actually a year before we opened, we started doing a lot of education in the community through billboard and radio, print ads, articles, social media, every outlet we could really think of to educate the community on what our name was, what our name meant. By the way, Statera means balance in Latin. And what does true balance mean? What does it mean to have a balanced, healthy lifestyle? What does it mean to approach health and wellness from a mind, body, spirit, from an integrative standpoint? And so just really educating the community on that. And it was very interesting. You know, as we opened our doors, people were very curious in the beginning, and they would come in. Like you said, our building is very beautiful. Thank you for the compliments.
Oh, it's all natural materials and just really nicely done.
Very unique for our community. You don't really see much of anything like it. And so people were very curious about the building, first of all. And so when we had our open house, I think we had nearly 500 people come through our open house.
Well, that's a lot. And given that Dubuque has 60,000 residents?
Yeah. And so, you know, the building was full, and it was very interesting. The feedback we got from our clients was exactly what I was looking for, because when I created this building, I wanted it to be really a healing experience for them, from all the different senses. Everything they see, they hear, they smell, all of it is a part of that healing process. From the time they pull up in the parking lot and see the exterior of the building, all of the natural earth elements are very grounding, the colors are very grounding and soothing, to when they come in and the lighting, the aromatherapy, the music, all of those things are very specifically chosen each and every day in each of the different areas of the building to be able to support what we're doing in the different areas. And people, I think that helped maybe it click a little bit better for them in that mind, body, spirit interconnectedness. Oh my gosh, what I smell is making a difference in how I feel right now. Wow, that smell is making me feel more calm. A lot of people, when they come into the building, they say they just immediately feel this sense of calm and they can't really explain it. And so it's fun. I do free 30-minute consultations with people so that they can come in and learn more about who we are, what we do, what we believe in. We're not woo-woo, we're not scary, and not have that, scary feeling of that big investment or any of those kinds of things up front. But to be able to come through the door, see what it looks like on the inside, see what the people are like, and then talk with me about what they're looking for, what their needs are, so I can help kind of answer some questions for them, point them in the right direction, the right services, the right providers. And most all of them will say a couple of things. Most all of them will say, I just felt so peaceful, so relaxed. I felt like I got a big hug when I walked into the building. And our team shares, our team is really beautiful, quite honestly. I have to definitely give our team kudos because we couldn't do what we do without each and every person in this building and the individual unique parts that they play. And, from the receptionist, that first person you see when you walk through the door, to the provider that you see, the instructors for the classes, the girl that helps us with laundry and stocks linens. Most of the people who come in and try us out say, and the people all are just so friendly and so helpful and so genuine. It's just refreshing. I don't feel like I'm just a number. I feel like I'm a person. I feel like I'm cared about. And then the third thing, we've talked about this a little bit already, is that integrative approach. Wow, you guys really do communicate about what you're doing. You really are on the same page. We have patients who test us, right? They'll ask the MD a question and then they'll ask their massage therapist a question, the same question, to see what they both say. And typically we are on the same page. We may have different perspectives. Is going to, present to our clients what we believe to be truth, so that then they can make the decisions that they feel like are right for them. Never make our patients feel pressured to do anything any one way, because we're not cookie cutters, right? We're all unique.
Right. So which of the marketing efforts that you undergo in an ongoing way has been best for you? Now that you're up and running, what do you find is the best to bring in more clients/patients? Which do you call them, clients or patients?
I go back and forth, right? Probably gone back and forth 1,000 times today. Honestly, it depends on the discipline. Some disciplines are more likely to call them patients, but typically as a whole in the building, we do refer to them as clients most of the time, because most of them are shared by multiple providers. And so we tend to refer to them more as clients because they are coming in and investing in their own health and wellness, and they are a part of the team as well. We don't want to approach it so much as a patient provider kind of a situation, because then they're no longer seen as an active participant, right? They're seen as somebody who needs to be taken care of. And that's not really what we want to portray here at Statera. So yeah, a little bit of a side jog there. Sorry.
It's okay.
But back to your marketing question. I have a whole new respect for marketing. And, oh my gosh, all the different elements that are available for marketing and the people who specialize in all of those different elements. In the beginning, we basically took advantage of absolutely every possibility we could think of. We did everything.
Sure.
said, from billboard to print to radio, a little bit of everything. Joining your local chamber of commerce, I think, can be one of the most beneficial things.
Oh, good.
Getting that inside to the business community and introducing to them who you are and what you do, and how you can. We live in a relatively small community here of 60,000, like you said, and so I want to be able to support those other small businesses, and I want them to support me, and so helping them to better understand who we are and what we do is very helpful. They also supply some marketing typically along with their membership, and so be sure you look into that, take advantage of those opportunities. And then ongoing, we do try to more tailor our marketing funds as we are learning more about which marketing avenues are most advantageous for different aspects of our business during different times of the year. We'll usually do billboard down to a couple of times a year rather than so frequently. And we've really increased our social media presence now that we have more followers. Website, I think, is key. I'm actually in the process of redesigning our website, hoping to launch the new one very soon, because having that information at someone's fingertips. What's the first thing we do these days when we want to learn about something, right? You found me through our website.
Right, exactly.
Websites are definitely, I believe, key. And I would encourage people, don't just hire your website data and never look at it. Be an active participant. I actually do my own website design because I always feel like this is a very unique business. And it's difficult for me to download what's in my brain to somebody to build a website for me. And sometimes I'm able to gain better clarity as I'm building the website into what's actually in my brain. So it really helps make more sense of everything. And then it's nice to be able to have feedback from our clients, how they like the website. How user-friendly is it? Are you able to find what you're looking for? Do you want to see more content on the website? And it's nice to take advantage of those opportunities for podcasts, articles, blogs, videos.
So you see it as a resource for them to learn things as well.
Absolutely.
That's very smart.
Yeah.
So we're in a time in the United States when we are challenged with staffing. How has that worked for you in your model?
Great question. We are a very unique business model, as unique as our business itself is. It's a unique business model. Our providers are not hourly employees. They are independent contractors. And so they are independently contracted to come in and care for our clients. And then we have hired support staff. And so kind of looking at the two different ones, providers, I really haven't struggled because we had such a great team of providers going into COVID and then the difficulties through the last couple of years that stayed strong through, the last few years with us. And then we have fortunately been able to add some fabulous providers who, as they learn about our business model and what we do, they were attracted to wanting to practice in a place like that. So we have added additional members. I would say the one area we've struggled in being able to grow has been in mental health, because mental health, even before COVID, was a very underserved discipline here in our community. They were already needing more providers. And then through COVID and everything, we need more providers. And so it's been difficult to attract in additional providers because there's just not a lot out there looking for work right now.
Right.
And the need is still very high, but there's that supply and demand issue right now. And so we're really focusing our efforts on utilizing other services for those individuals, maybe struggling with more anxiety, depression, the isolation, those kinds of things, using our behavioral health nurse practitioner, using our trauma-based yoga instructor, using our meditation instructors, our heart math instructor, opening up those additional opportunities to let people know that if you're struggling with your mental health, it doesn't necessarily mean that mental health therapy is the only thing that can help you.
Good point.
So many other things to help you take care of yourself too.
Mm-hmm.
And so that's where we've kind of been focusing those efforts and looking at hourly employees. I've been very blessed. Our hourly employees, again, we had a very strong team going into COVID, and we still have that strong team with us. And so we've not necessarily struggled in finding more help for that. So,
well, it's fortunate also, Nicole, it seems that you're finding all of these interesting providers in a small town. You know, you might worry that there was someone that did heart math or somebody that did trauma-based yoga, but you're finding those.
Yeah. And they're finding us, which is even better, right? Sometimes you feel like you're looking for that needle in the haystack. And fortunately, the needle is usually coming to find me.
That's great.
Which is beautiful. I don't often have to advertise that we're looking for any kind of a provider. They usually come find us, which has been a beautiful thing, because then I know that that provider is not coming just to sit in their four walls and see their clients and then punch out for the day. They're actually there, they're invested, and they believe in the mind, body, spirit, integrative philosophy. And so there's somebody who is going to go above and beyond to learn more about everything that's available in the building and really integrate into this team. So
that's been a real benefit of you being different, you know, is that you stand out as a place to work when it comes to looking for that. Definitely. So I would be remiss in not saying, let's talk for a few minutes about finances.
Sure.
You know, you bought the land, you built this building, is not inexpensive. Has the business been profitable?
Surprisingly so. You know, when you come up with an idea like this, a lot of times you're met with those individuals who are going to be critical, right? Mm-hmm. They're going to be the what ifers. They're going to be the, well, we don't see that model anywhere, so maybe it's not going to work. Mm-hmm. How is it going to work? You know, why do you believe it's going to work? And so it was a lot of thought and time and energy and effort doing my research in the beginning, touring different facilities kind of all across the country, calling facilities across the country, looking at their websites to better understand what are, you know, other places currently offering. Mm-hmm. And in doing all of that research, I found some really fabulous places that were so kind to answer questions for me, so that I could learn from some of their mistakes as well as from their successes. Mm-hmm. And then be able to take all of the different bits and pieces that I learned from all of the different places, kind of mush them all together and come up with the business model that we wanted to use for Statera. And then presenting it to the accountant and the banker and some investors, there were those questions of, how in the world are we going to get this thing to work? And what happens if it doesn't work? And I went into it knowing that it was going to work. I just had this peace about it. I really did. I just knew it was going to work. I had no doubt in my mind. It was full steam ahead.
But you still had to convince bankers and investors.
And so gratitude to the investors that helped us out in the beginning as well. And then fortunately, my husband and I were in a place in our lives where, you know, we had been in practice for quite some time and had been able to accumulate some resources to be able to put into the building and the startup expenses. And then found an accountant and a banker who were willing to take that plunge with us. And now it's interesting, 4 years later, every time we look at quarterly financials, my banker just shakes his head and says, wow, this is incredible. We are still growing faster and bigger than anybody projected or anticipated.
So will there be more Stateras in the future, baby Stateras?
I believe there will be. I always have believed there would be. I don't know that we would do another site here locally, but I do believe at some point we will do other sites somewhere in the country. I'm not sure what that's going to look like yet. There's a certain part of this business model that, yes, would be relatively easy to duplicate, but then you can't duplicate this team. And that is truly the key to making something like this work, is finding the right team members with the right vision to collaborate and really bring it to reality.
Quick question. Do you accept gratuities? Does anyone there accept gratuities?
Oh yeah, absolutely. And so based on our discipline, those disciplines that traditionally accept gratuities in other spas and locations do here as well. So our massage therapists all accept gratuities. Estheticians, acupuncture, and reflexology are typically the ones that accept gratuities.
And you mentioned to me when we talked first that some, you have insurance coverage, but not everything is. I mean, so is that difficult to navigate, having medical services that are not covered by insurance?
Absolutely. And so it's an ongoing learning process for sure. Anytime you're dealing with insurance, I believe this is not a healthcare system, it's a sick care system. Our medical system is very broken really right now. And so we were very hesitant in the beginning to even accept insurance at all. We really considered doing a strictly cash-based model, and decided, because we lived in a small community and people are so used to using their insurance here, we decided, you know what, we're going to have to accept at least some insurances for a portion of our services, to really be sure that we are able to grow this practice the way we want to in the beginning. And then we can always reassess and decide what we want to do in the future. And so we accept some of our biggest carriers. Our MD, nurse practitioner for the traditional medicine, do accept insurance. But then, as we talked before, those more functional medicine types of therapies and tests are not typically covered by insurance. And so we do try to be very, very transparent with our clients to let them know what will be insurance reimbursable, what will not be, so that they are aware of those costs, those out-of-pocket expenses up front. And then most individuals over the course of the last 4 years have learned that this is worth the investments. This is worth the investment. Even though insurance doesn't cover it, that doesn't mean it's not a valid or necessary or useful test. It just means insurance doesn't cover it right now, and I don't think that's right, but I can't change it. And they're willing then to make those out-of-pocket, investments.
Well, I think it's a matter of educating the public, right? And I like that distinction you make. Like, just because insurance doesn't cover it doesn't mean it's not worthwhile or good for you.
Right. Absolutely. And so just because insurance will cover testing for you for food allergies, but they won't cover it for food sensitivities, that doesn't mean that that's not impacting your health and wellness, and that won't make a difference in your recovery. So yeah, MD, nurse practitioner, our mental health providers, our chiropractor, our physical therapists are the ones that typically accept more insurance. And then the rest of our providers are more cash-based, more of those holistic therapies, complementary therapies, just traditionally aren't covered by insurance. And so people are used to paying cash for those. The biggest challenge has been, yes, number one, educating community for sure. And then number two, finding a platform that we could use for our billing, our invoicing, submitting for insurance, those kinds of things. And so it's a little complicated. We couldn't find one system that would
I'm sure there's not one that does all of this.
Not one out there. So if anybody listening to this podcast, if you have any ideas, I'm definitely open to those. But we currently have 2 different systems that we use in the building to take care of those that do insurance versus those that don't, all of our retail purchases and those kinds of things.
And you do sell retail as well.
We do. Yeah. So we sell some retail product. We don't have a large storefront, but we do believe in carrying some of those key products that are either difficult to find outside of here, or those key products that our providers consistently recommend to make it easier more convenient for our clients to be able to just purchase those on the way out the door rather than needing to go and find those somewhere. Sure. I don't have any water in here. Sorry.
No problem.
Choked on my own spit, I think.
Right. A question also would be on do you offer memberships at this time, or do you plan to?
That has been something we have tossed around off and on over the last 4 years, and we do not currently offer memberships. It gets to, because I have independent contractors seeing our clients, it gets to be a question of then how are those independent contractors paid when there is a membership involved? And it becomes very complicated.
I agree. I'm asking because I'm sure people will be curious, but honestly, if you're profitable and growing and making money the way you are, it's maybe more trouble than it's worth to have a membership at this point.
At this time, that's what we've decided. And so we don't do memberships, but something that we have played with off and on over the last few years is providing opportunities. How do I explain it? Like, we'll do wellness retreats where individuals can come in for a half day or full day retreat and experience a lot of the different.
That's a great idea.
Services that we have here in the building. And so, no, it's not a membership, but it's an opportunity for them to make a relatively small investment to be able to experience a lot of the different things that we have here in the building. We also do what we call Thursday evenings are for healing, where we highlight some of our lesser known, lesser utilized therapies sometimes here in the community, like the reflexology, where they can come in for mini sampler sessions for a reduced rates. We're doing special package promotions now where every 2 months, so bi-monthly, we do a package purchase that includes certain services at a discounted rate, certain product maybe for free, and then additional discounts, so that then that also encourages individuals to take advantage of some savings and at the same time try some new things.
And I saw that you have a Lunch and Learn series.
Yeah, we do Lunch and Learn series every spring and every fall. Before COVID, we did them in person, which was amazing because then we were able to, have the community into the building. We do those free. And so people could come in, bring their lunch with them, or sometimes we even provided lunch. And then our providers would take turns presenting different topics that clients could come in and learn about. Don't even have to be a client here at Statera. It was open to anybody. And now through COVID, we are starting to offer those virtually. And we've found that people are really appreciating being able to do those on demand as well now. So if they're not able to log in, at the certain time, they're able to watch it later, or they're able to share it with a friend or family member if they'd like to. And the Lunch and Learn series have been a phenomenal way, kind of like podcasts, to connect with our community and educate our community, share some knowledge, some tidbits that they can use right away to maybe help improve their health and wellness, but then also awareness of opportunities where they can come into the building to take advantage of more.
Well, it sounds like everything is working really well, Nicole. Your vision, it was incredible. And I just love how all these pieces are fitting together. And I loved your comment when we talked earlier about patients, clients not having to be broken or sick to come in and learn about being healthier. That's really a wonderful model.
That's when I started working more on the vision and the mission of Statera, what it was we really wanted to accomplish, how we were really going to be different from anyone else in the community. those kinds of things. I really kept coming back to, I wanted this to be a place where people felt safe, where they could come in, like you said, before they're sick or broken, preferably, so that we can help them learn preventative health and wellness, how to care for themselves as organically as possible to prevent disease or dysfunction. But then if they are sick or broken, that's okay. Come and we can definitely meet you where you're at. But then also wanting to instill in clients, health and wellness is not a one and done. It's not come in for your appointments, check it off your list, you're healthy and well for the rest of your life. Health and wellness is a journey, and it's an ongoing evolution of what you need at different stages of life, through life transitions. And we want you to be here as a part of our community so that we can walk with you on that journey.
Well, it's perfect because we can't be healthy without effort, right? And I love that your name incorporates Statera Integrated, like it all works together and people have a part to play as well in their own health. I think this is a time where worldwide consumers are realizing more than ever that they do have a responsibility to make some smart decisions and play a role in living a healthy life. So wonderful. Thank you so much for sharing your story. It's inspirational. Listeners should definitely visit stateraintegrated.com and see what they have going on, and keep your eye on this space because I think Nicole has many more ideas up her sleeve. We shall see.
Thank you so much, Lisa. This has been just wonderful. I appreciate it.
It was a pleasure to have you and your great story. Thanks again.